if somebody already has side effects, if this is the case, is there any way, doctor, to minimize them in the future? And maybe you can also comment on to some of your strategies that I find very unique that you mentioned in one of your videos, very good video. And you had like 5 strategies that you kind of propose for minimizing side effects. So that's very interesting. So maybe you can go into that a little bit.
So Mr. Matt, I would like to add that Propecia finasteride is not for everybody. Everybody cannot tolerate this drug for many reasons, psychological or organic. And today's population is generally sedentary in nature. Youngsters are sedentary in nature. They're stuck to the computers, still working from home or working all the time on computer and very little exercise. These youngsters today have usually low gonadotrophin hormones, low sexual hormones. So if you do not have enough testosterone, male hormone, enough drive which comes from your testosterone hormone, this medication can play havoc with your libido, with your sexual life.
And here I would also like to refer to a nice page, testosteronedecline.com, where you can actually check where your country ranks in terms of average testosterone levels. And the guys who are behind this page are doing a wonderful job. They're updating this page very frequently. There was last update done on the 3rd of November this year. And what they do, they pretty much pull up hundreds of studies from all across the world, and they look at the testosterone levels in all of those studies. And based on this data, we can also see how rapidly testosterone levels have been decreasing over the last decades. You can also check how your country has been doing over the last like 3-4 decades. So if you look it up here.
So the case selection before putting a patient, exhibiting a patient with finasteride has to be proper. It cannot be that a patient takes this medication over the counter. As it is not an over the counter drug, but many countries it is freely available. So it is not to be taken lightly. This drug has to be taken under supervision of a competent doctor who knows, who has been treating hair loss for several years. This drug comes with side effects, but if a patient is counseled properly, if biochemical parameters are taken into consideration before starting the drug.
You would recommend somebody to do a specific screening before taking finasteride?
Before taking finasteride, I would like to get, number one, your testosterone level, your estrogen level, your BMI, your sperm count, to rule out everything that could be wrong. Later on, a patient can ascribe these to taking finasteride. So to rule it out, once you start the medication, then you can't say what it was all due to, because people talking about PFS. What they lack is initial biochemical parameters which were not done. Total testosterone level done and estradiol level done to rule out hypogonadism, because these are the people who as it is have side effects and they just need to take finasteride and just need to watch a few videos online and they will end up with a problem.
You started about BMI, that's body mass index, for people who don't understand it. And you mentioned in one of your videos that you don't advise taking finasteride for people who have a certain body mass index that is, I believe, 30 or higher, which means like obese or overweight individuals, because we see in those individuals experiencing also other diseases like diabetes, hypertension, potentially depression. And these are also factors that correlate with higher occurrences of erectile dysfunction. And that might be also then the reason why these people have those side effects, may not be necessarily also related to finasteride. So that's why Dr. Bhatti likes to rule those people out who are already quite susceptible towards developing side effects from finasteride. Not even talking about that, these people have, a higher body fat percentage, and we know that aromatase is also being expressed in fat cells, and that's something that can actually make people more estrogenic, since that's the hormone that converts testosterone into estrogen, and thus could also increase the side effect occurrence that people complain about. Now, if we come back to PFS, post-finasteride syndrome, you as a physician who has been prescribing this drug for more than 15 years right now, Are you a believer in post-finasteride syndrome? Have you encountered this phenomenon with your patients or not?
Mr. Matt, I am not a believer in the PFS syndrome, the post-finasteride syndrome. I don't think it exists. You can't blame everything on finasteride. You know, when you have not baseline testing, lab testing, baseline sperm count testing, everybody is not healthy. You expect that you're taking for granted that you are healthy. 40% of people have low testosterone level, Mr. Matt. Do you know that? 40% is a big number. And the number of people who have impotence, people who have, infertility is on the rise. Now, you can't say that you are infertile because of finasteride. There is a huge population which is not taking finasteride and is infertile. Now, what happens to a person who's not got his baseline testing done and ends up infertile, ends up impotent? He can't blame it on finasteride. And if he was infertile, if his sperm count was low, if his testosterone levels were low, if his estrogen was high, where was the need of starting him on finasteride? Health is far more important than your hair. There are many options available if you don't have hair besides hair transplant or medication. But your health is more important than your hair. That's what I feel. I've been prescribing routinely. I think I insist on each one of my patients to take finasteride. Some do follow my advice, some do not. But I have seen that it is a very rare phenomenon having side effects after finasteride. It's extremely rare. Yes, people have it initially in the first few weeks, but they get over it as the body adjusts to the new changed milieu interior, the new hormonal balance. The body adjusts. They get over it in 4 to 6 weeks. They just have to be patient.
Exactly.
Also, it goes hand in hand with the randomized controlled trials done on finasteride. Especially, I'm gonna link it or pull it up on the screen somewhere. There was this 4-year placebo-controlled study done on 1,524 patients where they observed finasteride versus placebo side effects as far as impotence, libido, ejaculation, and all these problems. And interestingly, the finasteride group was a little bit higher in terms of occurrence of side effects in percentage, maybe 2 to 3% higher than the placebo group. That was in the first year, but in the second, third, and fourth year, it started to decrease, whereas, funny enough, the placebo group on some aspects actually started to increase. So it was, for example, in impotence, the placebo got actually higher over time, whereas the finasteride group got actually lower. So that's something that we can see, and it's interesting that you are seeing the same in your practice. So if somebody has side effects, maybe even mild ones, like maybe some pinching in the balls or in the chest area, in the nipples, where people maybe get, or some odd sensations initially, they tend to usually resolve with the time, right?
So many times patients ask us, why such a dangerous drug you're giving us. See, we are not the patient's enemy, and we are not profiteering from finasteride. Finasteride is such a cheap drug. It hardly costs $10 a month. No doctor would be profiteering from prescribing finasteride. But a doctor would definitely prescribe a medication which gives results. There is no alternative presently, no drug which is even close to finasteride in sustaining, retaining your hair in the long term.
So what would be maybe like the youngest individual you have ever prescribed finasteride? What is your limit where you start prescribing it? Because we know the DHT importance in adolescent and pre-pubertal, development of sex organs and sexual male characteristics. So what would be the age limit?
So finasteride is an FDA-approved medication for hair loss for last almost 30 plus years. And this medication is advised to be taken in males who are 18 plus, over 18 years of age, not any lower. But I go a step further. I do not prescribe this medication to those below 21 years because the sexual characteristics, the secondary sexual characteristics which are determined by DHT are not fully developed in the male till he is 21. So I would not like to put the patient on finasteride till he is 21.
Understood. So do you also see higher occurrence of side effects by certain age groups? Maybe younger guys are reacting differently to older guys?
Older people have less side effects than young people have, I've seen. Young people are more obsessed with their hair loss, and young people are more obsessed with taking finasteride. They'll be all over the internet and searching for all side effects. And the mind is so powerful, Mr. Matt. If you search for this, your mind is going to convince you that you have a side effect. Sex is in the mind. A person who does not have a robust mental makeup, as it is, he's not a candidate for finasteride. Let me tell you. This is not a medicine for the meek.
For the meek? It's for somebody who is very timid and not feeling.
Yes. Yeah. Who gets carried away by his friends, his relatives, and what he reads on the internet, and is very fearful of everything that he suspects might be true.
Totally. A huge mind game. We have the studies done on Nocebo phenomenon, that people who were counseled on the side effects about finasteride previously versus the ones that were not, these ones had much, I don't know how many fold higher chance of experiencing those side effects in the end, but it was a big number compared to the group that didn't know about the side effects. So if you get value out of this video, make sure you give it a thumb up, subscribe to the channel, and once the whole interview will be available to watch, I'm going to put it right here so you can watch the whole podcast. Until next time.